Activity 2 of the urinary anatomy lab is all about slice man and the urinary system. So this is slice 12 of slice man, the top part of slice 12, although you can see these same structures on the bottom view of slice 11. Here is the right kidney, left kidney, and then these green structures are part of the urinary tract. And what I would really tag on here are going to be the ureters here, ureters. I would not make you tell the difference between like major, minor calyces or the renal pelvis here. It would just be the ureters on the outside. So left ureter, right kidney, left kidney. Now the lab tells you to go back and review major cardiovascular vessels, digestives of the organs of the digestive system, organs or bones of the skeletal system, and nervous system. So some things we can see, here's the spinal cord. This is probably part of a lumbar vertebrae. Here is the liver, gallbladder, ascending colon, descending colon, spleen, pancreas. This is all small intestine, so it's good to review. The next slice, which is slice number 13. All you can see as far as urinary goes is going to be the ureters, which you can see it's the green ureter. Here's the left ureter over here. Still small intestines, cecum, ascending colon, ileocecal valve, descending colon, sacrum, ileum. This is an intervertebral disc here. The next slice, which is slice number 14. Here are some femurs here. Ischium, I believe here, coccyx, rectum. And this is actually the prostate. So don't get confused and think it's the urinary bladder. It's not. This is the prostate gland. And so this is going to be the urethra running through it. And we will learn with male reproductive that is actually the part of the urethra that passes through the prostate is called the prostatic urethra. And so the male urethra has actually different sections, and we'll get to that with reproductive. Here's the pubic bone, pubic symphysis, femoral vein, femoral artery, and I think that's good for that one. Slice number 14. The rest of the femur here, sorry, it's hard to squat for this long. But here's the rest of the femur here, the diaphysis of the femurs, right femur, left femur. This is still prostate gland. This is still prostatic urethra. There's the anus. These are penile bodies of the male reproductive system. Spermatic cord here, but we'll talk about those structures later. But that should be good for urinary system.